Hey guys, welcome back to my channel. My name is Precious and I'm a registered nurse. So today we'll be talking about a very sensitive and emotional topic, and that is miscarriage. Miscarriage is one of the hardest things a woman can go through. It's very painful, very emotional, and it can leave you with a lot of unanswered questions. What did I not do right? What did I miss out? How did I get it right? How did I get it wrong? And it's just it. But today I'll be walking you down the causes, the signs and symptoms, the prevention, and how to cope, through miscarriage if you've experienced this, or this is what you're just going through as I speak to you. Okay, miscarriage is the loss of pregnancy before 20 weeks. So if a woman loses her baby or her pregnancy before the 20th week, is known as miscarriage. A lot of women actually lose their pregnancies even before they realize they're pregnant. Mind you, most miscarriages are not caused by what a woman actually did. Sometimes it occurs based on some factors that you can't control, like you don't have any control over it. It just had to occur. So the next time as a mother that you sit beside your bed or by the corner of your bed crying for a loss of a baby, mind you, it's not always your fault. So let's talk about some causes of miscarriage. Number one cause of miscarriage is chromosomal abnormality. Chromosomal abnormality is one major cause of miscarriage, especially in first trimester. So this happens when an embryo or a fetus has the wrong number or structure of chromosomes. A normal human has 46 chromosomes, 23 from a father, another 23 from a mother, so making it 46 chromosomes. So when these chromosomes are either higher or lesser than 46, it can actually lead to some chromosomal abnormality known as Down syndrome or Turner syndrome. And naturally, the body has a means of just expelling it out. This is not just what it should be. I should let this out, and then the baby leaves. So sometimes when this happens, it could be as a result of chromosomal issues. Another cause of miscarriage can be as a result of hormonal imbalance. Progesterone has been known to maintain pregnancies. So when a woman is having a low level of progesterone, can actually lead to miscarriage. Another cause is cervical or uterine abnormalities. Something like fibroid, weak cervix can actually lead to miscarriage. So if a fibroid is planted or is growing in a position where a fetus is supposed to be attached to or is supposed to be growing in a part of a womb, right, it can actually lead to miscarriage. And also, if a woman is having a weak cervix, that is, the cervix is opening prematurely before term, it can actually lead to the expulsion of the fetus. Another cause of miscarriage is improper implantation. So after fertilization, if the egg does not implant properly on the walls of the uterus, it can actually shed off, causing miscarriage. Okay. Another cause is overweight or underweight. So women that are underweight or overweight can actually experience miscarriage, and that is why before you think of getting pregnant, please watch your weight. If you're underweight, get yourself involved in some dietary approaches. Okay. And also, if you're overweight, you can actually hit the gym or get yourself involved in exercises that can help you shed some weight, because overweight, underweight can actually alter your hormones. Okay. Another cause of miscarriage is rhesus incompatibilities. This is something that a lot of people don't know about. Okay. So if a woman is negative, her rhesus factor is negative, and then she gets pregnant with a positive man, with a positive partner, and the body has already previously built antibodies against a positive protein cells, this can lead to miscarriage. So if you're a woman and you probably must have committed abortion before now for somebody that is positive, and you didn't take the Rogam medication, and now you're getting pregnant again for a positive partner, likelihood of you experiencing miscarriage is very high. Also, if you're married to a partner that is rhesus positive and you're rhesus negative as a woman, no abortion before, no, but you've had a child before or a previous miscarriage for a positive partner, you can actually lose the subsequent babies or pregnancies that might be coming your way. Okay. Also, if you've experienced miscarriages before, there is still high chances of you experiencing it again. Age is also a risk factor for miscarriage. So women that are above 35 years of age are at risk of experiencing miscarriage due to chromosomal abnormalities that comes with having babies at older age, like 35 years and above. Okay. And these are things that could cause miscarriages. Now let's talk about the signs and symptoms of miscarriage. What are the features or signs you will see that will actually make you believe or make you sense that I'm losing this pregnancy? Now, before I move into those signs, I want you to know that some miscarriages can actually be prevented. Yes. So if you get some of those signs, don't just sit at home and then worry or wave it off. Sometimes rushing to the hospital or calling the emergency can actually save that baby. Except in some conditions, like I said earlier, where these pregnancies are meant to live. You can't stop them. So number one sign of miscarriage is bleeding, either in spots or heavily. Sometimes this bleeding are in spots, either red in color or brownish in color. But this is also a sign that you might be losing a baby. So you should actually pay attention if this blood is coming out in spots, or it's coming out like it's flowing, or it's coming out in clots. It's a sign. Another sign to watch out for is cramping. This pain that you feel in your lower abdomen, it keeps coming and going, keeps coming. It's a very sharp pain actually. So when you start noticing this constant pain on lower abdomen, you should actually get something done about it as soon as possible. Another sign is passing of fluid or tissue from the vagina. Water-like kind of fluid or some particles. You just look into your discharge, probably in your toilet or in your panties, and notice some things like these are tissues, part of your babies that are living. Okay, so if you notice these signs in your panties or in the toilet after using it, this could be a sign of miscarriage. Another sign of miscarriage is a sudden decrease in the symptoms of pregnancy. You no longer notice the headache, you no longer notice the tender breast, you no longer notice the nausea, you no longer notice all those pregnancies. If you just notice that they are decreasing, it's a sign of miscarriage, and don't take it for granted. Get to the hospital. Sometimes drugs like progesterone, that is if it is caused by a decrease in progesterone, can actually help prevent this miscarriage from occurring. So it's better you head to the hospital and your GP or your O&G says that everything is okay, good one, than just relaxing and then everything goes haywire. Okay, so make hay while the sun shines so that you can keep that baby. So let me just chip in the types of miscarriage, maybe for knowledge wise, or as a woman, if you're experiencing any of this, you at least know what you might be experiencing. Number one is threatened miscarriage. So threatened miscarriage is a kind of miscarriage that happens when you're having this sharp pain, you're bleeding, but your cervix is still closed. So this pregnancy might still continue, or it might not, but most times it continues. It's just a threat. It does not it's just a threat. It didn't really happen. Okay, number two is inevitable miscarriage. This is kind of miscarriage that happens when your cervix is opened, everything is coming out. You can't help it, you can't stop it, everything is coming out. Number three is incomplete miscarriage. This time around, some part of the baby or some part of the tissues of the baby are gone, they leave. Some will still remain. So it's incomplete, that's the word. So some part of the baby goes off, some is remaining, and most times you'll be advised to just take everything off. Sometimes D&C, or evacuation, just to let everything go. Another one is complete miscarriage. Everything has gone, everything is gone, all the product of conception is gone, the womb is empty. Okay, now with an ultrasound, nothing is detected there. Now the last one is missed miscarriage. The baby is still there, but there's no life in the baby any longer. There's no heartbeats. So the baby is still there, but there's no heartbeat. So most times you just evacuate the baby. Now let's talk about the prevention of miscarriages. Like I said earlier, some pregnancies can be preserved, while some you can't just help it. But sometimes you need to put some effort to prevent some miscarriages from occurring. Number one way to prevent miscarriage is getting your regular checkups early. Get to meet your physicians, your doctor, your midwife on time. This will help detect some abnormalities that can be treated to prevent miscarriages from occurring. Number two is take your prenatal vitamins. While folic acid cannot prevent miscarriage from occurring, it can at least help prevent spinal bifida from occurring. And sometimes these things can lead to miscarriages. So if you can at least help yourself, nature might help itself too. Number 3 is avoid smoking, avoid taking alcohol, avoid taking caffeine, avoid taking illicit drugs. This can harm your baby. This can harm an ingrowing fetus and it can lead to miscarriage. Number 4 is watch your dietary approaches. Eat healthy. Eat something that will help prepare your body to carry a baby, so that you don't just take in and then everything leaves. Okay, if you already have an underlying issues like hypertension, uncontrolled diabetes, thyroid issues, or any other autoimmune issues, please get your doctor on time. Let a proper assessment be done, proper management be done. Keep to your drug regimen. Okay, this will also help prevent miscarriages. Treat sexually transmitted diseases on time before thinking of getting pregnant. If you're having HIV, start taking your drugs on time to reduce your viral load and also help your baby grow healthy. Another one is know your rhesus factor. It is a major thing that a lot of women today are going through without knowing that their ignorance of their rhesus incompatibility has led to constant or repeated miscarriages. Wash your fruits, your vegetables with salt. Eat healthy. Take milks that are pasteurized. Don't take unpasteurized milk. Eat well cooked meat and fishes. All this can help prevent miscarriages. So if we can help ourselves as mothers, we can actually keep our babies. The emotional pain of miscarriage can really be challenging and traumatizing. The pain, the guilt, the what did I not do right can really be challenging and overwhelming. But remember, it is okay to take your time and heal. Talk to your partner, talk to your mother, your friends, your consultant, your doctor, your psychologist, your therapist, joining a support group, anybody you know that can be of help to you in order to heal from the pain that comes with losing a baby. Please do well to talk to them. Okay? It's a matter of time. You'll get over it. Another baby will come and you have your child. Miscarriage is never easy. If you actually experienced this or you've gone through this, please drop a comment on how you overcame it or how you were able to pull through. A lot of women out there are really going down every day for losing a child. If this video has helped you, please drop a thumbs up, drop a comment, like, share this post to somebody out there. Thank you so much for watching today's video. See you in my next one. Bye.